So if we take a look at sort of like diseases historically, in the 1900s, heart disease and cancer were ranked quite high up in the mortality rate, and communicable diseases accounted for quite a lot of deaths, around about 60%. Lifestyle diseases have their onset later in an individual's life, so they need a longer lifespan in order to cause more death. So the very short life expectancy of I think it's just below 50 years that people were expected to live up to in the 1900s was too short for degenerative diseases compared to like today, or like where it's like 80s, where unlike today where people are expected to live into the 80s. So you can see that there's a gradual increase in the amount of sort of degenerative diseases over time. So in like the 1940s, there's an increase in the degenerative diseases. And then as you get to the 1990s, like the majority of diseases aren't caused by communicable diseases, they're caused by degenerative diseases. And then more sort of modernly speaking, as of 2013, most 23% of deaths were from avoidable causes, and at least 60% of potential avoidable deaths were among males, while 70% of female deaths were deemed potentially avoidable. 28% of male deaths were deemed to be avoidable. This includes deaths that could have been avoided due to public health interventions such as vaccinations and changes to lifestyles that could have made a difference. This all sort of indicates that males are at a huge risk. So why might this be? Males tend to sort of die younger. I know it's sort of stereotypical, but they tend to take bigger risks because physiologically speaking, the frontal lobe of the brain is actually slower to develop, and this is the part of the brain that controls judgment and consideration for an action's consequences. This likely contributes to the fact that boys and men tend to die in more like violent ways and in more accidents than girls and women. Stereotypically, they also tend to have more dangerous jobs, so like they're usually like seen as a soldier, and they have like the big strong policeman and the fireman and all that sort of jazz, so they're more likely to die violently as they're in more dangerous jobs. Men are 50% more likely than women to die of heart disease. This is due to the lower estrogen levels than women. There's also medical risks such as the fact that they don't really like going to the doctors, so they don't get treated for things like high blood pressure or cholesterol levels. Men also tend to be physiologically larger than women. A sad fact is that many men tend to avoid seeking mental health care for things like depression, and stress is due to cultural expectations of them. So they don't seek mental help and often commit suicide. And then again, referencing the fact that they don't tend to like going to the doctors, so they're more likely to skip on routine health checks and less likely to book doctor's appointments if they feel unwell.